Hi. I'd like to call the Health Committee meeting for November 1st, 2021 to order. We have all members present except Member Bloomfield. And we have minutes to approve from October 4th, 2021 regular meeting. Do I have a motion? Motion by Beer, second by Chung. Are there any additions, corrections? Hearing none. All in favor? Aye. Any opposed? Okay, minutes are approved. Do we have any members of the public? Okay, thank you. Moving on to departmental matters. First up, Jessica McKnight, Health Department Administrator.
Hello.
You have no items for action. You have your monthly report. Is there anything you'd like to point out or say to the committee?
Nothing to highlight other than I know that I think I mentioned it in my report, but the advisory committee ASIP is meeting tomorrow and Wednesday, and probably going to be discussing the 5 to 11-year-old age range for the COVID-19 vaccine. So even when that happens, we still have a few more pieces to put in place before we would be able at the health department to go forward with vaccinating 5 to 11-year-olds, but we're anticipating it soon.
Okay, any questions from Ms. McKnight? Member Johnston.
So given what we know about like the doses that are available, will we have enough or will there be a shortage like before?
So the 5 to 11-year-old is actually a different vaccine, different dosage. So it's coming separately, and we're anticipating the order should be here in time for the approval.
Okay, thank you. And then I had a question for you, and I don't know if you know this off the top of your head, but as we're going to be tackling the budgets a little bit later, I did want to ask, TB was such a huge thing here 100 years ago. How many cases does the department actually deal with on an annual basis?
I don't have that stat, but I can definitely get that for you.
Okay, thank you very much.
How are we doing on boosters?
We've definitely been busy. So IDPH is working on getting data separated to where not only, they're fully vaccinated and one dose, but they're looking at getting the data separated to by county show boosters as well. So we've been busy for sure, especially with the Moderna.
Okay. Member Chung.
Thank you. I was just about to ask about that, about the, I'd read things about like this mixing and matching thing. Is that the Moderna because of people who are trying to mix and match then, or do you know anything about that?
So yeah, if you got Pfizer, Moderna, as long as it has been 6 months, you can get a booster of Pfizer, Moderna, any of those, and Johnson & Johnson, as long as it's been the 28 days, you can mix and match with Pfizer, Moderna, or another dose of Johnson & Johnson. So it's definitely added some complexity to it, but also opened it up a little bit more. So we definitely do have vaccine on hand and are really able to meet the needs and the wishes of the community.
Anyone else? Okay, thank you. Next up, Nursing Home Administrator Tim Wiley.
When you speak in the mic, you have to hit the bottom right-hand corner. Yep.
Hello.
Welcome on your first day.
Thank you.
To the Health Committee.
We made it.
You did. You have an item for actions, request approval of the nursing home 2022 private pay rate, which is found on page 8 of your packet. Can I have a motion? Motion by Martin, second by Chung. And since this is your first day, I'm sure you really are totally ready for this, but
Comprehensively.
does anybody have any questions about this? Nope. Okay. All those in favor? Aye. Any opposed? Okay, that motion passes. And then there's the monthly report, which I believe Kim Bolster had written
Correct.
on that. Is there any questions that anybody has about that monthly report? Member Johnston?
And I would love to direct this to you, but since it is your first day, I actually wanted to direct it to staff. In the report, we had a negative expense report, and I just wanted to clarify, Kathy, I think you were the one to address that and just explain how we ended up with the negative expense.
So I believe it was last month, we approved an amendment to pay the nursing agency expenses from the American Rescue Plan. So what we did in September was we moved those expenses out of the nursing home budget and into the American Rescue Plan. So that's why it looks like there's negative.
Because there was a credit?
Right.
Okay, that's what I wanted to clarify. Thank you.
You're welcome.
Any other questions? Member Chung?
Yes, thank you. And I guess along that same line, we have, I looked at, I noticed that too. And then about the revenue, we had a lot more than we have, I guess, in the past. Is there a reason why of that? Is that because of the, I don't know, anything in particular?
I believe it's because their census is increasing.
That's great news.
Just thank you very much for this wonderful opportunity. It's a privilege to be a part of McLean County. I'm looking forward to what's ahead for us. I'm excited what I saw in the team today. There's a good team there, and it's a good home, and we're looking forward to taking it forward.
Thank you. Thank you very much. Next up is Suzanne Scott from Adult Detention Medical, and I do not see her. She's on the floor again, I'm sure. So there's a item for actions, request approval of an agreement between the County of McLean and Eric Aberu, DDS, for dental services in the jail. Motion by Johnston, second by Metzger. I think that this is just a continuation of previous contracts that we've had.
That is correct. There are no major changes to this contract, and Dr. Abreu has been the dentist that is serving that population. He's had this contract for a while, and we are very pleased to have that relationship. He has great customer care in a population that is needed.
Okay, thank you. Any questions? Hearing none, all in favor? Any opposed? Okay, that one is approved. Next up is Jason Tabb, the Juvenile Detention Superintendent.
Good afternoon.
You have your report in here. Is there anything you want to comment on, or
No, I don't believe so. Be happy to answer any questions.
any questions from the committee? Member Johnston.
Thank you. I noticed that the census was a lot higher, like you had a lot more admissions this month or in the report than usual. Any indications about what led to that jump? Because I noticed that there were 19 admissions and 17 releases. So there were kids that were kind of in and out pretty quickly.
Yeah, we had a lot of in and out. I don't have any reason why. I haven't tracked to see what the crimes were. There wasn't a group doing specific things, and they were from all over.
So they weren't all from McLean County?
They were not all from McLean County. No.
Okay. Any idea how many came in from outside?
What was the total number?
It was
19
total.
I would say 11 or 12 were out of county.
Okay. Okay. That answers the question. Thank you.
I think that's in our report, in our packet for tomorrow, Justice Committee, probably, as to how many are out of county.
I believe it's broke down for justice, yes.
Any other questions for Mr. Tabb? Hearing none, thank you very much. Next is Ms. Taylor, Interim County Administrator. And you have a couple of things.
Yes. So the first item for action is a return to our budgets that we did not cover at our last session. So the first one is a request for approval of the Health Department 0061 fiscal year 22 recommended budget for the AIDS Communicable Disease Control Grant, Fund 107, Environmental Health Program 0061, and Personal Health Services Program 0062.
Motion by Martin, second by Johnston. This is what the Board of Health had, these two items, both of them, were what the Board of Health had requested to review again prior to our approving that. And because of the ARPA funds that were going to be used for contact tracing, they wanted to make sure that they were very clear as to what, that there was going to be enough funding there for that before they approved that part of the budget. And so at our meeting, we went ahead and approved that the way it was written. They had to be shown that they're in a different fund, and so they're not showing in the actual budget line items for the health department. So that is one of the things that we clarified at the Board of Health meeting. So, and I believe we also then got funds also from the state. I think they changed because we were waiting to hear some of that kind of thing too. So everything's cool with the Board of Health. But they just wanted to make sure before we approved that. So are there any questions on that? Member Johnston.
I did have a question. Like, I know that I did read the report that we had gotten the extension for the contact tracing and the mass vaccination. We still have it kind of zeroed out. Do we know when we might hear how much to anticipate? Or is that just something that when it comes, we'll approve it?
When it comes, we'll find out when it comes.
Okay.
There was no date or no dollar amount attributed to that, according to Jessica McKnight in the gallery.
Okay. Thank you. Just wanted to see if we could find out when.
Any other questions? All in favor? Any opposed? Okay, that one is approved. And so then number B, you want me to read it?
Sure.
Okay, is request approval of Health Department 0061 fiscal year 2022 recommended budget for the Health Department 112 funding for all of those, B1 through 9. And that also had to do with ARPA funds because of the van that was originally budgeted in the 112 fund was then now going to be used with ARPA funds. So that got zeroed out. And so the Board of Health wanted to make sure they understood what was going on there too. So it's just a clarification to make sure that they're okay with all the stuff that's going on with ARPA funds. Just it's a timing thing with when the Board of Health meets, when we meet, when our full board meets and everything too. So any questions on that one? Do I have a motion?
What line is
Yeah, I do.
that?
Say that again?
What line?
On the van?
Yeah, that
It
you
was
took-
in 96. Capitalized
B8.
assets, 850, on page 52.
So in the budget, you'll identify that the department head had requested 300,000 for the van for community outreach. And it was zeroed out by the county administrator because that was encompassed in our ARPA budget.
So did we have a motion on that? already? Oh, I'm sorry. All right, motion by Johnston, second by Chung. I moved a little too fast. Any other questions? Okay, hearing none. All in favor? Any opposed? Okay, that one is approved too.
Thank you.
Anything else?
I have nothing else to be presented this evening. Thank you.
Okay, thank you. Under other business and communication, reminder, next meeting is on Monday, December 6th, but it's at 4 o'clock instead of 4:30 because of the city council. And then the Health Committee for the regular schedule for 2022. I know that Julie had sent out a poll. I have no idea what the results said. And I also talked with Member Barnett about if the land use and transportation eventually get combined together. He was willing to work a little bit too on property committee timing. So there might be another option that was not included in that poll. So I guess we're just gonna have to wait and see what happens with that part of it before we make a decision on moving forward, but, because I don't know the results of the poll.
Is
Member
property
Metzger.
Thursday? Property is Thursday?
Yes, property's on Thursday, currently at 4:45. And so
Correct.
there could be some adjustments in there so that maybe they'd start a little earlier and we'd start later than 4:30, obviously. So still kind of fluid here. Trying to accommodate as many people as possible. Member Johnston.
Would it be possible to ask Miss Scott what would be a good time for her as well?
I can't hear you.
Would it be possible to ask Miss Scott from the jail nursing unit what would be good times for her as well? So that she could be
Okay,
here for those.
Ms. Taylor can follow up on that
Okay,
also.
thank you.
Any other comments about that? Did everybody send back their poll? Okay. Any other business or communication? Hearing none, we'll move on to the bills, which the auditor has reviewed and certified that they all comply with our ordinances, resolutions, and policies. First up here is Board of Health with prepaid total of $427,652.48. Motion by Beer, second by Chung. All in favor? Any opposed? Okay. Nursing home has a prepaid total of $220,613.28. Motion by Johnston, second by Beer. All in favor? Any opposed? Okay, that passes. Jail and JDC Medical have a prepaid total of $33,753.31. Motion by Chung, second by Metzger. All in favor? Any opposed? And passes. And the Developmental Disabilities Board has a prepaid total of $136,757.94. Motion by Johnston, second by Beer. All in favor? Any opposed? And with that, I believe we are adjourned. Thank you all.